MARTA Research's Chronic and Integrated Care program is about improving treatment outcomes and preventing chronic disease.
Through a greater understanding of the biological causes of chronic diseases, our research teams are developing preventative strategies and innovative treatments to improve patient outcomes.
The program has already achieved groundbreaking outcomes.
What's unique about the Chronic and Integrated Care program at MARTA Research is that we integrate with a lot of other researchers within MARTA Research, MARTA Hospital and also Greater Brisbane, Australia and overseas.
We are across all clinical specialties. We allow our patients to have access to frontline clinical trials across all phases of clinical research, and we're really ingrained and embedded in the biomedical research space as well. So this stream has that real unique opportunity to integrate chronic disease care with doctors at the MARTA and biomedical researchers over at MARTA Research. My team is particularly strong in clinical trials, which have completely transformed care for cystic fibrosis. Prior to the clinical trials, the person living with cystic fibrosis was lucky to make it into adulthood. So now people have a normal quality of life. They can live with a chronic disease without the fear of death. They can have families and children. We've had a lot of our young adults living with cystic fibrosis are now here at the MARTA Mothers having their babies and families of their own, and it's just amazing to see.
One of the highlights of MARTA Research has been seeing an idea come through fruition from a hypothesis to the point where we actually have a preclinical drug that we've now formed a company on to try and progress towards clinical trials. My research focuses on inflammatory bowel disease, a debilitating inflammatory condition of the gut.
One of the biggest achievements here at the MARTA Research would be the identification of a novel genetic mutation that is responsible in IBD. We actually identified a novel mutation in a family that is based here in Brisbane. And our identification as well as research in preclinical studies have actually enabled us to diagnose a patient within the family quite early, as well as enabled effective treatment plans.
So my research focus is a complication after spinal cord injury, which is called neurogenic heterotopic ossification. And this is a pathological bone growth in soft tissues. So these patients have already been impacted with their initial injury, and we're hoping our research helps them to progress quicker with their rehabilitation.
At the onset of the COVID-19 pandemic, we were actually at the forefront of preclinical COVID-19 work at MARTA Research and the University of Queensland. And we discovered a novel treatment strategy to treat severe COVID, which can also be used for other respiratory infections such as influenza. My research has really accelerated over the last couple of years towards translation. So the basic findings in the laboratory are now being translated by biotech startups that we have founded together with other partners to really develop new drugs that can go into clinical trials and then be actually used in the clinic.
So our research focuses on diabetes, which touches most people's lives in Australia. We're particularly interested in finding new therapies to combat type 1 diabetes and also complications of diabetes such as diabetic kidney disease. Our team has found a really novel way to look at jump-starting the power stations in your cells. We know that these power stations don't work properly when you have diabetic kidney disease, and we're trying to get them working again.
My biggest achievement at MARTA Research has been helping to identify that adrenal glucocorticoids that are released after spinal cord injury are actually driving this pathological bone formation. And I hope in the long term that this can lead to better preventative treatments for patients.
I hope to mine the untapped resources of the microbiome to find novel therapies that will improve patients' lives.
We are trying to understand why disease behavior in each IBD patient is so different. This is particularly important to be able to tailor treatment options specific to individual patient rather than more generalized treatment options we have currently got.
Through the generous support of the MARTA Foundation, we've been able to fund projects in the seed level before we can get access to grants, which has allowed us to explore avenues that we wouldn't have been able to do if we were constrained to traditional funding bodies.
I was a recipient of the Betty McGrath Research Fellowship, which enabled me to fully establish the clinical trials unit that we have here that's enabled us to do all this amazing research.
Without MARTA Foundation, the discoveries that we've made in my laboratory would not have been possible.
My research career actually began here at the MARTA Research around 7 years ago, initially as undergraduate semester student. I then stayed and performed my honours here as well as PhD studies, and now I'm currently working as a postdoc here in inflammatory bowel disease group.
My interest in pursuing clinician scientist pathway started when I was in my undergraduate education, where I became fascinated by the ways that we could apply science to today's health problems. I really cut my teeth working in HIV/AIDS research, and from there have expanded out to understanding the role of microbes and the immune system in health and disease.
The reason that I do research is because I know that there are many unanswered questions, and these still impact the lives of people living with diabetes, and I really want to make a difference to them. So our objective is to make a world where no one develops type 1 diabetes, and those who have it, we can actually hopefully reverse it. The Chronic and Integrated Care program at Mater Research helps answer the questions as to why more people are getting chronic diseases, and we're looking for therapies to actually stop that from happening.